Well, celiac disease is when the body cannot tolerate gluten. Gluten is a protein that is normally found in wheat, rye, and barley, very common in many different foods. What happens when people with celiac disease eat gluten is the small intestine, a very specific part of the small intestine called the villi, is attacked by the body's own antibodies, and they begin to shrink up. They deteriorate, they become damaged. And because the villi are so important in absorption of nutrients, one of the principal problems with celiac disease is malnutrition.
So what are the symptoms? Like, how do you know if you have it?
Well, this is one of the big problems. The symptoms can be quite vague, and which is why it is often underdiagnosed or misdiagnosed, like abdominal distress, gas, bloating, diarrhea, bone or joint pain, irritability, weight loss. A variety of other symptoms can also be included. But again, these are generally vague, so it can be confused with other problems. One of the principal reasons why many people don't realize they have it for even years at a time.
I mean, most of us listening are thinking, I've had one of those at some point. So is there a test you take for it?
There is a test you can take for it. Now, the test is a test where they actually look for those antibodies or autoantibodies that are attacking the small intestine. But doctors need to have a high degree of suspicion that that test might be necessary. So awareness of the symptoms and persistence of the symptoms might trigger this test. But even more importantly is it's a genetic problem principally. In other words, it runs in families. So if you have a family member who has this problem, you might want to consider getting tested yourself.
All right, let's say you find out you have it. How do you treat it?
Very simply in one way. It's actually kind of complex in the end, but you avoid gluten. Gluten, as I mentioned, is found in wheat, rye, and barley. That is in so many food products. Now, oats potentially can be a problem for some people, not for others, but you can find many products out there that are gluten-free, but the bottom line is avoiding gluten in the food supply, which means that you want to avoid pastas and cereals, many processed foods.
All right, all the food here on the table is gluten-free.
That's right.
So if we could just, we're showing
you'll
it
see,
now. No.
Fortunately, food manufacturers are aware that this is an enormous problem for many people, and they are now making products that are gluten-free. It's important that you look for gluten-free specifically because in the processing, you want to make sure that they don't reuse equipment or manufacturing equipment that might be contaminated with other products that they've used that do contain gluten. So do look for the gluten-free.
Where do you find it? Any grocery store?
Increasingly, yes. Now, sometimes it can be more expensive than other foods, but the bottom line is that if you do follow this diet, most people will heal within a matter of days. The symptoms will start to go away, and within 6 months, the intestines do heal. Can be tricky to follow this diet, but it certainly can't be done.
All right, this is important information. Thanks a lot, Emily.